Critical limb ischemia occurs when the arterial blood supply to your leg, typically, it can also happen in the arms, becomes so little that your leg or your arm is in jeopardy. And usually what the patients complain of are either non-healing wounds on their feet, usually on the toes, or a toe is turned black, which we call dry gangrene, which is a scary term, but all it means is that you have a black toe. Or the third possibility is that you have something called rest pain. And rest pain is a very specific type of pain in your foot at rest that occurs at night when you lay in bed. If you have just barely enough blood flow to your foot to keep it alive when it's in a dependent position when you're sitting and your foot is down, because gravity is helping, it's trickling a little bit of blood down to your foot. And then you go and you lie in bed and you put that foot flat up on the bed. After about an hour, you won't have enough blood supply to your foot and you'll get tremendous pain in the top of your foot and your toes, and you'll actually have to dangle your foot over the side of the bed in order to relieve the pain. If that happens to you, you have critical limb ischemia and you need to see a vascular surgeon. The risk factors for critical limb ischemia are the same as for any other arterial disease. The number one is smoking. Smoking, 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 smoking. Everything else is secondary to smoking. If you can quit smoking, you're going to do a lot better in the long run than if you can't. But other things such as diabetes, high cholesterol, hypertension, family history, and advanced age also play a role. So at VIR, there's lots of different treatment options for these types of patients. It doesn't automatically mean surgery. Most patients do need an intervention once they get to that point though, because they just don't have enough blood flow to keep the tissue alive. And if they're going to lose their leg, then we're almost always going to offer them some sort of treatment. The first line treatment of this would be an angiogram, where we put a little IV in an artery in your leg and then squirt some dye in the arteries and see exactly what the problem is. And then at that same time, sometimes we can use a balloon or a stent, which is a little metal tube, to improve the blood flow to the foot and prevent you from losing your leg. If that doesn't work, then we start to consider things like bypass surgery. If you're diagnosed with critical limb ischemia, that means that your foot or your leg is in jeopardy. And if it's not treated, you can end up with either a below the knee or an above the knee amputation, which is devastating, especially for our older patients. We are the experts at trying to prevent that from happening. And so if you have rest pain, as I described it, at night in your foot that's relieved by dangling over the side of the bed, or you have wounds on your toes that haven't healed in a few weeks or months, or a toe turns black, you really need to see a vascular surgeon. And we at Vascular Institute of the Rockies are well prepared to take care of that kind of problem.